I was having another conversation today with a colleague online about, women getting stuck between data and real life. And it's becoming harder for women to understand what they should be doing when there's so much misinformation, but there's also so much dogmatic kind of stick to the data standpoints that are out there. And it just reminded me of a really interesting story from actually my time as a trainee in medical school when I was doing an orthopedics rotation. And so the orthopedic surgeons would send us to do the rounds on the patients, to speak with the people after they'd had their knee or hip replacements. And anyway, I remember I would go and talk to all these people, and some were doing really well, some weren't doing as well. Some had a lot of pain, some had a lot of anxiety. Some had no one to take care of them when they were going home. But anyway, I would take my notes and I would go back to see the surgeon, and they'd be in their office. And I'd say, okay, we're going to discuss this patient next. And he'd pull up their x-rays and he'd look at the before and he'd look at the after with all of, the hardware in place. And he'd say, oh, that was a great surgery. They're going to be doing really well. And I'd be like, well, actually, they're in a lot of pain and they're really anxious, and I'm concerned because the wound doesn't look like it's healing very well, or whatever it was. And it just was this first exposure to the problem with treating, the data instead of the person. It's easy in a way to sit in a room doing research and looking at papers and assuming the real world reflects that. But when you're actually speaking to women, you sometimes see that's not the reality. This is where clinical experience and nuance really comes in handy.